Welcome to our very special Happy Birthday ORS Speech Pathology episode. Thanks for coming on, Camilla and Jane-Maree.
Thank you. Happy birthday.
Thanks for having us for our third birthday.
Yeah, happy birthday speech. Doesn't time fly when we're having fun? How are we 3 already? I can't believe it.
I don't know because I feel like I just started.
It's a blur. It's still a blur. I still remember when you first started and you said, wow, get your skates on. Yeah. And I think we're still skating.
That's right. I don't think that's exactly what she said.
It's exactly what
what I said.
It's exactly what she said.
I love it.
Alrighty, well, let's go back in time. Take us back to when we first started speech pathology at ORS.
And bring us through to the now.
Yeah.
I don't really know because we weren't here.
Make it up.
I feel like it'd be a big bang where we just arrived and then everything blossomed. We weren't here. So with some of our founding members, we've got lovely Dave and Nicole over in WA. So
Love
they
Dave.
were some of our first staff who've been here with us the longest. So they'll be able to tell you what happened with the Big Bang.
Okay.
But Jane and I came in Jane was a little before me, so we've been in here 2 years, a little bit longer. So we weren't here for the newborn phase.
Yeah.
No, we were definitely here when we were transitioning to solids. So I think I arrived probably around, definitely the 10-month age.
Yeah.
Okay. Yeah.
Just starting to walk. And
Yeah, I was definitely self-weaning, and we were eating solid foods a lot more.
Your first words coming soon.
Thinking about words. We're definitely starting to be intentional with our communication. Yes.
But when we started, we had sites, 2 sites in WA. We had two sites in Sydney. We had one up in the Hunter, and we had Gosford and Fishwick.
Yep.
And now we've grown for speech pathology. I know ORS has more sites. We're not at every site yet, but we're I think we're at 15 sites now.
Wow.
Yep.
Yeah. So we grew. The growth for speech pathology has been exponential at a time where it's really hard to find speech pathologists. But the best thing that's happened to us is that the team we have grown is a team that is really kind, passionate, like really nice people. Like our CEO and COO often say about speech, like it's just
Everyone's just always so happy.
Just really nice people.
And we love working with the speech team for that reason.
Yeah.
You're just so easygoing and happy to please.
Oh, I wouldn't call us easygoing.
No,
Well, you two are, but the rest of the team are.
I think we're very clear with what we would need to be able to be the best that we can in our profession, but we're also very kind with how we approach that, and that's our vibe. But we're also genuinely, our staff have, I think, a really strong focus on being so client-centred and caring that comes through in a lot of their interactions with everyone. So they are just genuinely really nice
People. Yeah.
which is good.
Alrighty, so looking at like all that great stuff we've had, all the things we've done over the last 3 years, what would you say was the biggest challenge that ORS has faced in the speech pathology sector?
I think one of the other big challenges we've had that we still continue to face is the effects of because we do have such a young or early career cohort of clinicians, we're still, I think, feeling the effects of what COVID had for their undergraduate clinical experiences. So I think that one thing the challenge we did face was recognising that, we had a cohort of early career clinicians that didn't have what was traditional undergraduate clinical learning experiences. And we didn't shy away from that, nor did we place the blame or the ownership of their clinical skills on them. What we've done is really well rallied around them and just supported and being able to be there to go, let's do more extensive teach and train. Let's take those concepts that you would have learnt as an undergraduate and let's give you opportunity to hone those skills now and not have unrealistic expectations on you just because you've got a piece of paper that says you should be graduated, that you should be able to do it. So I think we've rallied in that area and I think that's a positive change response rather than a stand back response. And I think that embodies a lot of what ORS does. Like we move into change, but we also move into change into change with a purposeful objective.
Yes.
Yeah.
Well, what's the future look like now? We've talked about the now and the past.
Future looks like cake.
Cake, yes. That cake's making my mouth water. But where are we going? Where's speech taking us to the next 3 years and beyond?
We've had a few. So some of the things that we're working on that have been emerging will get bigger, I'd say.
Yeah.
So students is something that has been exciting for us. at the end of last year, we took our first student. The placement was so successful.
Yes.
That student actually won a university award.
Yeah, that's right.
For best integrated placement.
Yeah, work integrated learning student of the year.
Yep.
Yeah, which was incredible.
Yeah.
And then so we figured out a way to take student placements are a huge amount of work.
Yeah.
But hugely rewarding as well. So we're currently getting off the ground with more placements this year that have been going really well so far.
Yep.
Say love students.
I do love students, yes.
Yeah.
But being dynamic with, and again, that change momentum, looking at how can we do a good quality student placement that helps the students meet their learning needs, they're nervous, but also the needs of the participants.
Yeah.
And then also, like, we're a company, so how do they meet our needs as well? So it has to be a mutually beneficial relationship.
Yeah.
And I think that's what we're trying to get, that concept in action. And each new placement we refine it a little bit more. So in ACT's got students at the moment, and they're really looking at how to use students to help manage wait lists, which is great.
Yeah.
Like, let's make a difference to our participants. And I think WA's got students as well, and that's what they're looking at as well. Like, doing intensive sort of bursts of intervention with speech pathology for clients, particularly in areas where we don't have high staffing levels or if we've got wait lists as well. So,
Great.
And I think the ORS, I think the next iteration of speech pathology is that we're going to start to do more like what Michelle's doing more in the broader community with the universities and with Speech Pathology Australia, and just being a little bit more present as a leader, hopefully, because that's what we strive towards being, and growing that side of our service delivery as well. Yeah.
And really looking at what our clients need and what we can offer to support with the skills we have or the skills that we can consolidate as well.
Well, looking at that, how do you think in the last 3 years diagnosis and treatment in general with speech pathology has changed?
Or has it?
What
Maybe
a
it hasn't.
massive question.
Yeah.
Larry just unloads the big one
I
on
know.
us. Yeah.
Well, I don't know.
I think, I mean, to be honest, I think our diagnosis, like our diagnostic skills, are probably still the same. But in the area of treatment, I think that there's a lot more movement in technology. And even when we look at, the use of AI and those sorts of technologies, I think that that's where things will start to grow more in the speech pathology world. So
Most definitely.
Yeah, it'll definitely mean some refresher courses for me. Because I am concerned that AI just essentially means Terminator.
No, we're going to work.
I know, I really, and they're there.
No, we're going to work with it.
So
We're going to work with it. All right, Camilla. So Camilla's going to hold my hand while I get through.
Some of our staff, the things that they, some of our staff, like Yin and some of the other girls, when they do telehealth sessions, like the
Next
program
level.
and the games they play, that like
That's cool.
Yeah. And just, I think also we've got like that nice melting pot talking about Yin, and just like a lot of her undergraduate research in that idea of gamification in speech pathology, and really broadening how we use, things, everyday concepts like games, but how do we use them really critically and in a therapy session to get the maximum buy-in for the client and benefit for the client as well. And her research was really quite interesting, just to find out, like what sort of games are your preferred types of games. Whereas usually we'd go in and go, well, everyone likes Pop-Up Pirate, which they do. But
Never heard of it.
what? Well, it's at the back.
We'll play Pop-Up Pirate later.
After the cake.
Party games.
Yeah, exactly. But just taking those concepts, those everyday things, and going, well, let's customize it to the needs of the participant, and recognizing that everybody does have individual likes and dislikes in that world of games, and that they can be used therapeutically.
And that's how you keep that engagement as well. If it's something
Absolutely.
they like, they're more inclined to actually be a part of it.
Yep, there's a reason why people sit and play games all the time.
Yeah.
Okay, so we hear a lot about speech pathologists and dietetics. Explain. What's this all about?
Yeah, we work really closely with dietetics in the area of nutrition and hydration and swallowing. So in those, we're like, here's in a pod, speech and dietetics, in that area. So it's the speech pathologist role is around determining safety of swallow, concerns around swallowing, or, therapeutic approaches to improving swallowing, management of food and drinks and saliva, and then we partner with the dietitian whose role is around nutrition and hydration. So basically the speech pathologist's role is around ensuring that meal times are safe, and the dietitian's role is around ensuring that people are receiving enough or the appropriate nutrition and hydration. And of course you bring in an OT because their role is important there as well, around having safe positioning and equipment for meal times. You want the BSP there as well in case to help with, positive behaviours around meals as well.
Yeah.
So
got to work in physiotherapy. Can't leave them. They need
Trunk support is really important.
Yes,
there we go.
Yeah.
Everything.
Yeah. Amazing.
Absolutely.
Good thing we can offer all of them here at ORS.
Yes, we
We
can.
can. How exciting is that?
We've got dietetics on board. They've been on for a while now. What are we at?
Almost a year. Yeah.
12 months?
Coming up soon.
Yeah.
Yep.
And growing.
Yep. And then we do like the
One-stop
education and
shop.
training afterwards jointly as well. So the speech pathologist will talk to the support workers around, like safety at meal times and the type of diet or fluids they might be on. And then the dietitian will come along and talk about like menu selection and, how to customise foods to meet the diet recommendations, but still providing choice and interest and likes, but also hitting those nutritional targets as well. Yeah.
Okay, this is an easy one. Do you guys both have areas of specialisation that you're interested in? Kids.
Camilla is definitely kids.
Yeah.
Absolutely.
She loves them.
My clinical background is in adults in acute hospitals, and my most recent role was in head and neck cancer, around working with people who have cancers of the head and neck, so tongue, throat.
I never knew this.
So people who need to have their voice box removed and then breathe and speak through an airway in their neck instead of through their mouth. So that's what I'm skilled at doing, and we do some of that work here at ORS. We're starting to do a little bit more where a few clinicians are skilled in that area. It's fairly specialised, so it's not a huge thing here, but also dysphagia, which is the medical word for difficulty swallowing. So that's mostly what I've done in my career. But I was just talking to Jane this morning about wanting to take that further into the paediatric space by doing some, utilising all the skills and resources we have within ORS to upskill in paediatric feeding, paediatric swallowing, fussy eating.
Yeah.
Because new area for me, and I think it'd be a good transition to use.
And
Amazing.
transferable skills.
Yeah.
Transferable skills.
And what about you, Jane-Maree? What's your specialisation?
I think I've always had most of my career, I've always considered myself to be a generalist, and that means that I'm comfortable working in hospitals, comfortable working in the community, comfortable working with paediatrics, comfortable working in adults. The last part of my job when I was in health, I was particularly working with students and running their placements, and that was the clinical load was adults. So for probably the last half of my year, more focus on adults in the hospital, in the community. Rehab was pretty much my focus. So where Camilla was very much more in the acute space, I was more in the rehab wards and in the community with clients. Similar caseload, but just different endpoint and different part on the trajectory of, I think, acute through to transitioning back to community. Yeah.
What about the future? Is there more you want to learn about or lies more in?
I think I'm as fascinated as Camilla is about paediatric feeding. I've done a little bit of it in the past, and I know I've got transferable skills in that area as well. I think there's part of me that wants to bite the bullet and do the big challenge around AAC stuff to just understand the technology a bit more. But I would definitely need to have someone holding my hands because I would be afraid that it's going to turn into a Terminator.
Yeah.
Yes.
Fair enough.
Definitely.
Well, it's exciting.
Yeah.
Excited for you both.
Yeah.
So generally speaking, in regards to wait lists, what's the wait list like at ORS for speech pathology?
It's different at every side.
Yeah.
So we've got some areas. So in Australia, there's a national shortage of speech pathologists. So wherever you are, it's a bit trickier to get a speechy. But for us, some areas have longer wait lists than others. So in the Hunter right now, there's no wait list. In some areas of Sydney, there's no wait list.
Wow.
Yeah, that's pretty rare.
Yeah.
Yeah, we'll just do that.
Yeah.
And then in other areas, down in Melbourne, in Pakenham, there's a very big wait list for our paediatric clinic.
Yeah.
And also in the ACT in Canberra. We've got quite a wait list there, but we're doing some interesting strategies around how to provide services for people who are waiting. Yeah. So we've got, last year we started working with allied health assistants, and at this point we have 8 allied health assistants working with us.
I did not know there was 8.
Across the country.
Jeez.
And they are really great with helping with waitlist management because they allow the speech pathologist to get stuck in doing an assessment, creating a plan, and then the AHA can work with the client to do the therapy. And the speech pathologist will be there to continually check in and, and adjust the program that they do. And then also telehealth is been really great because in some spots where we don't have wait lists, the speech pathologist there will offer telehealth services to the clients that are waiting as well. Yep. And we're also looking forward, so we just started running groups this year, which has been really great. So we're offering group therapy programs in some of our sites, which is going really well. And
happening this holidays, I believe.
This holidays.
That was for kiddies, wasn't it?
Kiddies, yeah. So it was our first go, so we're keeping it kind of small. But I think that'll be an exciting waitlist management.
I'm going to sing a happy birthday song.
Okay, well, I want you to sing it to us with your beautiful voice.
I'm ready.
Okay, we're going to start a smoke alarm. This is fantastic.
Should we just sing happy birthday normally? All right. Well, take us home.
I don't know. I thought that was actually quite beautiful.
Happy birthday, speech pathology. Happy birthday, speech pathology. Happy birthday, dear speech pathology.
Oh my goodness.
Good pronunciation.
Happy birthday to you.
Oh,
Swallow.
Oh, they harmonised.
Swallow. Swallow. Yay.